A major campaign pledge. The White House today said a popular plan to provide relief from prescription drug prices in this country will likely not make it into the Democrats' social spending bill. It's a huge victory for the pharmaceutical industry and big disappointment tonight for millions of American families burdened by the soaring cost of their medicines. Our Devin Dwyer has a closer look at the stakes in the debate and why some are still holding out hope Congress can get something done. It's the first installment of our new series, America's To-Do List.
As the cost of insulin soars, Laura Marston saves every last drop.
Most of these vials are expired.
When she was first diagnosed with diabetes 25 years ago, a vial of the prescription insulin she needs to survive was listed at $30. Today, it's close to $300, a 1,000% increase.
That's over $2,000 worth of insulin.
Insurance through her employer covers most of the cost, but when she temporarily lost her job and health coverage in 2012, insulin dependence led to financial crisis.
So I had to cash out my 401k. I sold all of my belongings. I sold my car.
It sounds like in many cases throughout that crisis period, you felt like a hostage.
I still do, every day. I feel like I live in a country that prides itself on freedom, but I don't get to be free because at 14, I was diagnosed as a type 1 diabetic.
Americans spend more on prescription drugs than anyone else in the world, on average $1,200 per person per year.
I don't think anybody's happy with how drug prices have gone up.
Sue Milliken of Ohio is a retiree and grandmother covered by Medicare. She says rising drug costs are eating away at her fixed income, and it's not just insulin.
Other drugs that I'm on have gotten very expensive. On blood thinners, on certain cholesterol medicine I've been on, they've been in the $200 to $400 range.
Why have wholesale prices of some of these drugs, which have been around for decades, skyrocketed just in the past few years?
Well, it's, partly what the market can bear. I mean, the United States is alone among developed countries in not having a role for the government in negotiating or setting the price of drugs.
While individual American insurance companies negotiate discounts with drug makers, federal law prohibits the government from doing the same thing. Consumer advocates say changing that law and allowing the government to negotiate prices through Medicare could provide sweeping relief for everybody.
The idea here is not just to have Medicare negotiate prices for its own program, but to extend those negotiated prices to private insurance plans as well.
By one estimate, the federal government could save $450 billion over 10 years.
Everyone would feel it through a couple different channels. In some cases, it would mean less out of pocket at the pharmacy. In some other cases, it would mean less that we'd pay for prescription drug coverage.
For diabetics, it could mean between $28 and $176 less for a monthly supply of insulin.
It would be a great first step to demonstrate that. And I think more people across both parties would benefit from that and would appreciate that.
A large majority of Americans, Democrats, Republicans, and independents, have consistently supported government negotiation of drug prices. But the White House today said the idea doesn't have enough votes in Congress. Drug companies have been lobbying hard against government intervention in pricing, saying it would upend a key part of the U.S. economy, leading to job losses and less money for research and development of new drugs.
Of course, we make profit, but it's not like we keep it, right? We return it to shareholders who give us money to take huge risk on R&D.
Lilly CEO Dave Ricks says even though the company made billions in profit last year, he'd have to cut experimental drug projects in half.
5 of the 6 medicines approved globally to treat COVID are from American companies, 2 from mine, and 3 out of the 3 vaccines that are used globally are from American companies.
One independent government analysis forecasts there'd be 2 fewer new drugs brought to market over the next 10 years, 23 fewer over the decade after that.
We are able to do things here in this country because of our freedoms and invent things and produce things. And I don't want to see restrictions to that. And I can see where it's happened in other countries where it limits how many drugs they get, when they get them, how fast you can get stuff. And I don't want to see that happen here.
It's really speculative to try to figure out what might happen, 10, 20, 30 years from now. I mean, we don't even know what scientific breakthroughs there will be, let alone what drugs might or might not come to market.
For now, the drug companies seem to be winning the debate, with Democrats looking for alternatives to bring much-needed relief for patients. One possible approach, setting limits on out-of-pocket expenses for critical medicines.
I went from basically $300 plus for every 3 months to $30.
$30?
Yes.
That's 90% savings.
Correct.
Blair Gormley says a new Virginia law that requires insurers to cover costs for insulin above $50 a month could be a model for the nation.
I could squirrel more money away, save more money for my daughter's college education. I think it should be across all 50 states.
What are the other options on the table in your view?
Something else might be capping price increases over time at inflation. And there may also be a change to Medicare's coverage of drugs, capping what patients have to pay out of their own pockets.
Millions of Americans like Laura Marston hope Congress won't squander this moment.
The drug companies set the list price. The drug companies alone chose to raise the price of my wholly unchanged insulin twice a year, every year, by 15 or more %.
Hoping years of debate over drug prices will finally lead to some action.
How confident are you that Congress will do something on this now at this sort of critical juncture?
Unless the government steps in and fights the fight for us, we have to fight it.
For ABC News, I'm Devin Dwyer in Washington.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.